Do you have a young pitcher who's complaining of inner elbow pain, especially after throwing? I'm Dr. Jeff Lewis, owner of Lewis Physical Therapy and Sports Rehab, where I've helped countless pitchers get stronger and back to throwing pain-free. Today, we're breaking down a Little League elbow, what it is, what signs to look for, and how we typically rehab it the right way. Little League elbow, also known as medial epicondyle apophysitis, is an overuse injury most commonly seen in youth baseball pitchers between the ages of 9 and 15. Between these ages, the growth plate is still open and vulnerable to traction forces. This typically occurs in pitchers that play year-round without a shutdown period from throwing, pitching on consecutive days, or ultimately just pitching without adequate rest. As a result, the repetitive traction forces of the flexor pronator muscles from throwing pulls on that growth plate and causes inflammation in that area. If you're a parent or coach, here are the main red flags. Pain or soreness on the inside of the elbow, especially during or after throwing, decreased throwing velocity or loss of command, stiffness or loss of elbow range of motion, notably with a loss of extension due to pain along the medial elbow, and the big one here is swelling or tenderness over that inner elbow. Players between the ages of 9 to 15 years old are most susceptible to Little League elbow, again, because their growth plate does not fully close, typically until 16 years old. For this reason, the growth plate is more susceptible to injury than the UCL, the ulnar collateral ligament. However, UCL injuries can certainly happen in pitchers this young, especially with the current trends that we're seeing in the youth baseball world. If ignored and pitched through, this condition can worsen to a stress reaction, which is swelling within the bone, a stress fracture, or even an avulsion fracture, which will require surgical intervention and a very lengthy and significant rehab process. So what does rehab typically look like? Phase 1 is protecting and restoring for the first 2 weeks. We usually will start with shutting down from throwing for a minimum of 4 to 6 weeks, decreasing pain and inflammation, and working on restoring full elbow range of motion. This is key, especially with extension and pronation and supination. During this time, we'll also use very gentle low-load isometrics to promote some muscle activation and pain relief. In addition, we will start to address deficits elsewhere that could have predisposed to this injury, whether it's poor shoulder range of motion or lack of scapular strength and awareness or core strength. Phase 2 is the build and strengthening phase for another 2 weeks, so weeks 2 to 4 roughly. Once pain improves and motion is restored, we focus on progressively strengthening throughout the shoulder, starting with the rotator cuff and scapular stabilizers and the forearm musculature. Phase 3 is preparing for return to throwing for roughly from weeks 4 to 6 after injury. So once foundational strength, stability, and motion are restored, we'll begin to reintroduce movements in the weight room for upper body strengthening and a brief upper body plyometric program to prepare the arm for a return to throwing through medicine balls and plyo balls. Phase 4 is the return to throwing phase. So that can start at week 6 and it might take another 6 to 8 weeks depending on the pitcher you're with. So once a pitcher begins their throwing program, they'll start to initially focus on increasing their distance from maybe 45 or 60 feet out to 120 for roughly 3 to 4 weeks. Then they'll begin a bullpen progression, face live batters, and then get into games. In these cases, pitchers will likely begin their game progression around 12 to 14 weeks from their initial injury. And during this time, they need to continue to focus on improving rotator cuff form and scapular strength through more advanced rehab progressions and strengthening exercises in the weight room. The biggest goal here is trying to make sure that they are stronger and more resilient than before their injury. Little League elbow is common, but it's not something to just push through. The earlier you catch it, the faster and more complete the recovery. If your son or athlete is dealing with elbow pain and needs help getting back to pitching pain-free, we specialize in rehabbing throwing arms the right way. You can check out our 10-week strength and speed system designed specifically for high school baseball players if you're looking to have them dominate on the base path, throw harder, and improve their explosiveness while decreasing their injury risk. And if you want a little more insight into how we go about helping pitchers with arm pain, text arm pain to the number below to get your free copy of the Arm Pain Blueprint.